today is another good day that we are here, and we want to what's this? We want to continue with the topic that we had yesterday. You saw what happened, and everything became the way it was. So today, let's deal with primary headaches. Let's deal with primary headaches, and see how we can manage them. So, what are primary headaches? There is something I'm trying to do. Let me see if it is done. So, everyone who is coming in, welcome. This is Benjamin the Wise Guy. The channel is called Benjamin the Wise Guy, and I am Dr. Ben. I am Dr. Ben, and welcome to the channel. Welcome to the channel. So, if you are here, you have any question that you want to ask, please ask the question. Please ask the question, and don't fail to ask any question that you have. And, looking at something, I'm doing something here. Oh no, I can't cancel it. So welcome my friends. Jamaican uncle just talked to Jamaican uncle a few minutes ago, and he's here. Welcome Jamaican uncle. Thanks for tuning in. So guys, we had started talking about this important topic that is called primary headaches, and we say there are types of primary headaches. Types of primary headaches. I'm setting up some things here. So what are the types of primary headaches? We have primary and secondary headaches. Primary are those that just come by themselves. Secondary are those that after a disease come, after a complication they come. And we have types of primary headaches. What are migraines, tension type headache, and cluster headache? Tension type headache, other trigeminal autonomic cephalgias. Cephalgias are also headaches. And we said the main thing that brings primary headaches is trigeminal nerve in the brain. This is primary headaches, not secondary. Welcome my guys. You who is watching and you have not subscribed, please give your subscription. Come to the chat text, tell us where you are watching from. Just tell us I'm watching from the US, I'm watching from Kenya, Africa, Ghana, Nigeria, or Asian country, and we become good friends. So like the video, subscribe, give me your subscription. When you give your subscription, we become friends. And here you can see Jamaican uncle saying blessings to you, Benjamin the Wise Guy, and everyone that is entering the house. I'm in the background cooking, so I'll be in the background. So everyone, welcome to this chat. You're talking to Benjamin the Wise Guy. We're talking to Benjamin the Wise Guy. Your subscription, man. Let's increase the community. Queen is here. Hi, Queen. Queen is here. Welcome, Queen. Doing good. Hope you are good. And the weather today where you are is good. Hi, Mr. Benjamin. Fiona, I saw you. I saw you helping your younger sisters with homework, and I liked it. Fiona is a good lawyer. She assists the young ones with doing some homeworks at home, does everything. So check out Queen, check out Jamaican uncle, check out Fiona, all of my friends that are here, check them out. Fiona, hope you are doing good in Uganda. I would like to visit Uganda one day and check you out as a lawyer. Yes. Welcome everyone. I'm still welcoming people. If you are watching me and you have not subscribed, what are you waiting for? What are you waiting for? Hit the subscription button. Hit the subscription button. Let's grow together. YouTube is all about growth and subscription and likes and forming a community like the one that I'm having right now. Fiona continue with that spirit. I like it when people help the young ones to grow and become people with integrity and dignity, like what Fiona is doing. Fiona is a lady of integrity. Always know someone of dignity and integrity when she is still here, and I can see that with Fiona. The coffee cakes, welcome to the chat. Welcome to the chat. I couldn't finish our topic tomorrow yesterday. You saw what happened, everyone. So everyone who is coming in, don't just come in, smile for me. Just as the coffee cakes is doing, smile for me, Jamaica. And I say, smile, girl, smile. Hey, I'm here for you, Jamaica. Hey, you have a rich history, a beautiful is a hidden skills. Welcome everyone. This is Dr. Ben and I'm welcoming you. Before we continue with the topic, subscribe to this channel, my friend. What are you waiting for? Just check out and subscribe. If you are a new guy, tell us where you are watching from. Come and join my friends in the backyard at the chat and tell us where you are watching from. You see, good people, good society, good vibes. Benjamin the Wise Guy channel gives you good vibes. Where are you watching from? Have you subscribed to the channel? As I'm getting ready for my work, just wanted to support. Thank you so much, Queen. And even Jamaican uncle has been working. This exercise of waking up and walking and going to exercise before the day, it is a healthy exercise. Everyone is doing it. So let's get healthy. Let's get healthy. As I'm here talking about health, best way to live, good way to sustain yourself and live. You are getting healthy and you see. So let's get healthy, my friends. Let's get healthy. I can see Fiona, Queen, the coffee cakes. I can see all that are in the chat. Jamaican uncle was the first one. Big up all the time, Jamaican uncle. So if you are here watching and you have not subscribed, you are missing a lot. Hit the subscription button and do what? Like the chat. Like the channel and come tell us on the chat where you are watching from and what are you doing right now. Maybe you are home watching, maybe it's on morning where you are. Here it is 5 or 3 p.m. In the evening. It's kind of like going in the evening. So where are you watching Benjamin from? Where are you watching Benjamin from? Big up everyone who is supporting. Everyone who is supporting, who is supportive, who is supporting each other. Big up yourself where you are. May God bless you with what you are doing. Now, today we want to continue with the topic that is called migraines, primary headaches, tension, primary headaches, trigeminal neuralgia, primary headaches, and cephalagias, other cephalagias. Those are called primary headaches. Everyone gets a headache once in a while and it subsides. That one is normal. People get headaches and they subside at times. But when people get headaches, yesterday I was asking, what do you do to help yourself when you get headache? And people tell me that they told me that they take some drugs, they take water, they lie down a bit, they take some drinks like coffee. All those are the ways to reprieve yourself from persistent headaches. So let's continue and understand what really headaches are. So we categorize headaches in 2 types. We categorize headaches into primary and secondary. And the primary, we said, are the headaches that you don't understand what is bringing them. You just have headaches. You just have headaches. Headaches are just coming through. And these headaches that are just coming through, you see, there is something that can bring this headache. You know, it means something somewhere is suffering. Somewhere in your body is suffering a lot. So let's talk about these primary headaches. What are primary headaches? Primary headaches are headaches occurs as a disease by themselves. They come as a disease by themselves. are not caused by any other medical condition, like brain tumors, meningitis, stroke, or head injury, and even dehydration. Those are primary headaches. So the major primary headaches that we have, are what? Are several, like which ones? We have several primary headaches that we have, let me see. We have several primary headaches that we have, let me say, migraine, tension type headache, cluster headache, and other trigeminal autonomic cephalgias. You see, so let's talk about migraine. We have said four. One is migraine, the other is tension type. Tension type. You just feel your head is like tensioned. You just feel your head is like tensioned. Just a minute, I find out. Don't move away from the card. I'm coming. I'm just coming. Let me pick something and then I come. Yes, I can see coffee cake still here. Everyone is still here. Sorry, I was taking care of something, and I'm back here. So let's continue. It will be a short session. I have to take care of something. So migraines are check here. Guys, if you have a question about headaches, please put it through. Let me finish with this. It will take a few seconds. Then I come. Yes, my people, and that is the life of a doctor. Hey, always up and down. So, my friends, my guys, how are you doing? Welcome. Let me welcome people again because I was not here. Queen was here, is here, is still here, Fiona is here. Coffee Cakes, welcome to the platform. Jamaican Uncle, welcome to the platform. Majay B, welcome to the platform. Sorry for that short time. I have to take care of some. I don't like people feeling pain, so I have to take care of them. Thanks for your patience and thanks for being here. Hey, the coffee cake says, please like, subscribe, and share. Yes, share. I think I'll have to get someone who can be hosting, a co-host. I'll get a co-host who is a doctor, so that when I'm chatting up, continues with this. And you see, that person should be having values that I have. So let's continue, my friends. Let's continue, my good friends. We were talking about primary headaches. Primary headaches are migraines, tension, and trigeminal related causes and encephalgia. So let's talk about migraines. And I'll ask you, what do you understand by the time migraines? What do you understand by migraines? If you are still here, please say yes, I'm still here, so that I can know who is watching. So that I can understand who is watching. Please, sorry for for the confusion. Sometimes as a doctor, you find yourself, you are starting something and an emergency comes, you have to go check what is happening. You are starting something, an emergency comes, you have to go and check what is happening. So don't worry. Sometimes it's a life of a doctor. Life of a doctor entails all this. So if you are still in the house, wave at me, say hi, Dr. Ben. Hi, how are you doing, Dr. Ben? And I'll tell you, Dr. Ben is doing fine. Can be debilitating or just annoying. Yes, migraines can be debilitating and annoying because they come and then you start feeling like vomiting. You start, migraines can make you feel bad, totally bad. Migraines can make you feel annoyed. That is true. They make you feel bad because you start vomiting, you start feeling, you understand those processes because of the trigeminal nerve. And I've said the trigeminal nerve comes from your brain. Let me draw a brain of a human being. Let me explain to you about migraines. Have you ever had something that is called migraines? Have you ever had something that is called migraines? What do you think about migraines? What do you think about migraines? Let me draw something and then you'll understand what migraines are. So if you are coming in, I'm drawing a trigeminal nerve. I'm drawing a trigeminal nerve. I'm drawing a trigeminal nerve. Just wait, you see what I'm drawing. Understanding medicine is understanding from, because this is something that cannot change. A human being cannot change the anatomy. So you have to draw. Just relax. I'm drawing something here that is very important for you to understand this. For someone to understand this. Yes, my guys, you are here, you're still here watching. Look at this. Look at this. So let's understand migraine. So this one from the brain, this is the nerve, it comes from here, cranial nerve number 5. So it comes on the one side and then it gives you, it comes here. This one is ophthalmic. Now it branches 3 times. It branches 3 times. Ophthalmic, maxillary here, and mandible. So when you are eating, chewing, this one is the one which innervates the mandible. Mandible is this bone. And then we have the maxillary. It innervates here, the muscles that are here. And then we have ophthalmic, innervates here, the eye moves, the muscles around there. So that's why I usually do this. From the nerve itself coming from the brain, and then it innervates. So this one is the main culprit of, this one is the main culprit of migraines. And now this thing is called trigeminal ganglion here, trigeminal ganglion. So let's understand. Celine Isaac, how are you doing? Welcome to the chat. I'm explaining something that is called migraines, and migraines is primary headache. In some contexts, they explain primary headaches as a context I watched you before. Oh, nice, and you are watching me again, Celine Isaac, and I think you have subscribed on my channel, right? That is nice. That is very good. Celine Isaac, you are my friend now. You are my friend now. Celine Isaac is my friend. Celine Isaac, you are my friend now. So, migraine headaches. So, when, migraine is said to be a nerve-related problem. It is called neurovascular, nerve-related problem. It is characterized by moderate to severe throbbing. You hear your head, pa, 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 usually on one side of the head. Why? Because maybe it might be this side that is having a problem, not the other side. You get? This trigemina is this side and this side. The branches come like this. So, often associated with nausea, vomiting, and sensitivity to light. And now you know, yes, doctor, I'm a doctor. Celine Isaac, I'm a doctor, and that's why I'm giving some medical talks. So when you have these problems, when you have these problems of nausea, vomiting, and sensitivity to light, why? Let's talk about this nerve that comes from your brain. Now, nerves that come from cranial nerves. So this one is the 5th one, but it has 3 branches. Ophthalmic. So when you have a problem with this nerve, you get migraines, throbbing, and sensitivity to light comes because of this branch, ophthalmic, maxillary, and so light, ophthalmic. It is having inflammation. So you may see one of your eyes having sensitivity to light. We have maxillary that comes through, and so you may be having some nausea because of the ganglion and irritation of this, and drooping of one side of your, you see, the throbbing headache that comes here, and then you see a person touching like this. Now you understand what migraines are. Migraines involves cortical spreading depression, a wave of neuronal excitation following suppression. You see, this wave comes from inside and then it spreads and goes back. Just like how people who have sciatica problems. Yes, Celine. Yeah, Celine, one day you said I'm having migraines. Now you know it was not a migraine. Okay, it's going on. Okay, nice. Now you understand what you had was not a migraine. It was just something, So migraines are these things that can give you real what? Problems. You see, now aura, you find an aura, sometimes vomiting, aura means something that just comes. You feel nausea that just comes. You feel flashlights that are passing. Why? Because the ophthalmic nerve branch has been affected. You see, welcome Celine Isaac. Thanks for tuning in. Hope you have subscribed and you have liked. Celine, like the video, double tap the screen. So trigeminal activation. What activates the nerve fibers? You see, nerves. I said your brain has several nerves. Your brain has several nerves, and the brains themselves have several substances that come out. They have several substances that come out. The nerves themselves. What comes out of your nerve when it is irritated? You know, irritation means maybe an infection. Something is compressing or is hitting it so hard. Or irritation means something is making you feel. You get? So what can irritate? If you are watching, tell me what you think can irritate something like a nerve. One thing I've told you is infection. Some drugs can be electrolyte imbalance, trauma, like something hitting you and then the nerve is irritated. That is one thing that can irritate you. You get? So these things that we are talking about, when you are irritated, just like inflammation. When something hits you, you start swelling. What makes you to swell is substance that is called prostaglandins. They make the place to swell so that more blood can come and more cells, white blood cells can come to help you there. So when the nerve is being irritated, it's traumatic heat or infection is there, or something that autoimmune disease is there. What happens is, just like inflammation, they produce some things. What are those things? They produce finding donor. Hi, welcome. We are talking about migraines, and I've said migraines come from this one. This is a nerve, cranial nerve number 5. We have said we have how many cranial nerves? We have 12 cranial nerves. I like explaining every time because a person may not capture all this at the same time. So we have 12 cranial nerves that help you do some things. Olfactory for nose, optic for nose, optic for eyes, oculomotor still for eyes, trochlear still for eyes. Trigemina is the 5th. Trigemina, facial, sensation, and muscle, ET. And then we have abducens. Abducens is the 6th cranial nerve, facial expression, and we have facial expression. Facial is number 7. We still have facial about the tongue. Interesting topic. Thanks. And then we have vestibulocochlear for hearing. That is number 8. And then we have glossopharyngeal. Vagus, number 10, accessory and hypoglossal. So number 5 is this one. This is what gives you migraines. This one. Nerve irritation of trigeminal nerve. You see? So migraines, people mistake telling people that I have migraines. Today I want you to know what migraines are really. And when you know what really interesting topic. Thanks, finding donor. Thanks a lot. And you guys that you have channels, when you come to my channel, you have to leave your link. My videos are watched daily, even after I'm off with students. some professionals wanting to criticize them, So leave your link, my friend. Leave your link. Leave your link and you will enjoy. You will enjoy. Now, let's continue. So, you see, I've said things that can irritate this nerve. And when you have infection, trauma, something that has hit you, or something that is irritating the nerve, you will get, the nerve releases something that is called substance P and neurokinin A, or CGRP, calcitonin gene-related peptide. Calcitonin gene-related peptide. You see, when you are hit, you start crying, you remove tears. So when you irritate a nerve, what does it do? It removes substance P, calcitonin gene-related, and neurokinin A. Those are things that it releases. When it is releasing these things, just as a swelling when you are hit, this nerve starts to swell. And then the things that this thing has released, the calcitonin substance P, they start making your head have inflammation. Swelling. Inflammation is swelling and pain. Mediators of inflammation. Outcomes of inflammation is redness, pain. If I hit you, I'll see redness, you will feel pain. You see, a swelling will be there. You get, a swelling will be there. Even infection, if it is in your hand, sometimes like a boil, you will see some infection, swelling, what you understand all these things. So I'm talking about the nerve. I want people to understand how can you get rid of inflammation in the body. hey, Donna. Now, inflammation is something that helps your body to get better. Let me explain about inflammation. I have hit you. I enjoy your special day. Thanks. thanks. And guys, there are good things at members channel. Yeah? Too much correction. No worries, Donna. Donna, no worries. We correct ourselves and we go on. Let me explain about inflammation. I have hit you, or you have fallen down and injured yourself. What happens? What happens is, where you have hit yourself, muscles have been injured. And the body itself will want to clear the dead cells, will want to remodel the bad areas of the muscles, the skin, you get. So for this to happen, it produces some things that are called prostaglandins at the area. And these ones are the ones which make you feel pain. The prostaglandins make that place to swell. Characteristics of inflammation, swelling. Second one, there is blood that will come there. A lot of blood. Why blood will come there? Why will blood come there? It will come with white blood cells, natural killer cells, macrophages that will clear the dead cells. It will come with, you see, the white blood cells that clear the dead cells, that clear the bad things. You see, I'm talking about inflammation. So, as you feel pain because the prostaglandins have been released, the white blood cells and the white blood cells and the natural killer cells are removing dead cells. As you feel pain, you get. So after the place has been remodeled, the prostaglandins have done their work, you start feeling better because the body starts adjusting, removing the prostaglandins. So when you are given a painkiller, what it does, when you take a painkiller, you are stopping the prostaglandins from coming at the area that you've been injured. When you stop the prostaglandins to come, what happens? Healing becomes short. Because you have stopped prostaglandins, so the problem healing becomes slowly. So finding donor 5234 has asked me, how do you stop inflammation so that you cannot stop pain? Now donor, you just stop prostaglandins from coming from the area so that you can stop swelling. But the problem is, if you stop the prostaglandins, what will happen? Healing becomes slowly. So as you stop the pain, healing is slowly. You see, as you stop the pain, healing is slowly. But there is another thing that we are talking. Hope donor is you have already answered yourself. Yes, God, I like it when I explain, and even before I give the answer, someone has already answered as well. Yes, it means I'm a good teacher, right? I should be teaching and lecturing. Yes. Now, let's talk about the nerves. And which nerve are we talking about? Cranial nerve number 5, trigeminal. Trigeminal nerve that helps in mastication, eating, in the mandibular and facial expression. Because it has 3 branches, and I've drawn it. It's this one. Cranial nerve number 5. This one is the one which gives you migraines in the brain. Migraines, my friend. People talk about migraines when they don't understand what they are talking about. So you have irritation of that nerve. And what can bring that irritation? 1, infection. Because infections injure your nerves. Bacteria can start eating your nerves. You can hit yourself or fall and hit the head. This will be injured. The nerve will be injured. Or, infections are of different types. We have bacterial infection, we have fungal infection, and we have viral infection. Any that can irritate this nerve. The thing, comorbidities, things that we were born with. Maybe you were born with brain or a structure of the head that one place does not allow the nerve to pass well. Birth problems, congenital anomalies. Congenital anomalies like neural tube problems like autism, ADHD, attention deficits, can injure this nerve. It may not be seen or recognized, but you are born with. That's why we have different types of neurogenetic complication, or we have different types of autistic, because classes of autism. J. Hank, welcome to the family, J. Hank. So you are born always having headaches genetically because of neurogenetic problems. Nice J. Hank, J. Hank. And it is continuously irritating this nerve, trigeminal nerve. What happens? Just like I have explained, can pain from toothache give migraines, doc? Yes, very correct. Trigeminal nerve comes from the brain, it branches, and then it comes to the mandible here. So if your toothache is infected and it is irritating this nerve, it directly goes to the brain, and the inflammation goes to the brain. And what do this nerve produce? Just like prostaglandins, they produce, your body produces prostaglandins as mediators of pain or mediators of inflammation. Now, nerves produce substance P, neurokinin A, and calcitonin gene-related peptide. 3 things, and those are things that make you have inflammation in the brain and the nerve, and then you start having a lot of pain. Just imagine from here or here, you have a boil here, and then it is hitting the brain. Wherever the nerve is excited and irritated, it transfers the pain to, because it is producing these substances, and these substances are being taken to your brain, and that's why you see people touching their brain. Migraines. Remember, the trigeminal nerve is 3 sides. So it may be one side, irritation is this side, or it may be this side, irritation is this side, or it may be both sides. See that, my friends? Now, I know someone is understanding what migraines are. I'm just going slowly. We understand what migraines are, because people come to hospital and they tell us, I'm suffering from headaches, and I'm used to them because mine are called migraines. But when you start looking, you find that this person does not have migraines. It is because of hypertension or diabetes or other. That is secondary, it's not migraine. So when these nerves are dilated, there is something called neurogenic inflammation, dilation of meningeal blood vessels. Inside the brain, there are blood vessels. Let me show you. I usually like showing you this picture. This blood vessels here. When they dilate, maybe they are irritated and they are dilated. They can irritate the nerves that are close to them, the nerves, and the pain signal is transmitted directly to the brain where these nerves are coming from. So blood vessels, when they are dilated and they are touching the nerve, the signal goes to the brain, and when it goes to the brain, you start feeling the pain, and you touch one side. It depends. Like, let me say like you are irritated here, this side, the trigeminal nerve that is coming on the left side. You see, the trigeminal nerve that is coming on the left side is the one which is irritated. You will have pain on that side, on the left side. You will have pain on the left side. You see, you will have pain on the left side. Guys, hope you are understanding migraines, and now you are answering yourself about, I know some people, many of the people have problems with headaches. Problems with headaches. So there are some things that can make a person be susceptible. When I'm saying susceptible, it means a person may be having more chances. My wife is calling me, hello Dr. Babe. Today no more hello babe. She's here. Hey, baby girl. Today I'm Dr. Babe. No more babes. Yes, let's continue. Thank you for tuning in and listening to migraines. So there is risk factors of you getting migraines. One is family history. A family history of being born with neurogenetic disorders of the brain, blood vessels that are not well, or the nerve that is not passing where it should be passing. Most have the problem. You get female sex. Female sex. Female sex have the problem. And for female sex, they have so many things that come through. Like, one, you may have hormonal imbalance. Two, menstruation cycles. Three, several things in women that make them to be susceptible. You get? Yeah. You get through. Stress. When you have stress, your brain releases some things that are called catecholamines. Catecholamines. I'm very sure my wife's account is being handled by my daughter. I'm very sure she's the one who is texting here. Now, female sex, stress, catecholamines are like steroids. They enhance inflammation in your brain. Sleep deprivation. Sleep, if you don't like resting, is equals to stress in your brain. So you release more catecholamines. And when you release more catecholamines, inflammation. The nerves release neurokinin A substance P with calcitonin gene-related peptides. Calcitonin gene-related peptides. Bright lights. People who like journalists, when they are on the screens watching, reading news, the bright lights, most of them after that they go for painkillers. Enhance inflammation. So, what are the features of of migraines? What are the features of migraines? Features of migraines, let's learn so that you cannot say that I am undergoing migraines without knowing what migraines are. They are unilateral. They may be unilateral, one side, because the trigeminal nerve is this side or this side. The trigeminal nerve is on this side or that side. They are pulsating and throbbing. You hear like the brain is You see, because the brain is undergoing inflammation and it is throbbing. It is throbbing. Moderate to severe intensity. It starts gradually, stepwise, as it goes to severe, because inflammation goes gradually. You see, it can go from 4 hours to 72 hours. And now that it is involving nerves from the cranial nerve, vomiting may be excited and nausea, feeling to vomit every time. Sometimes even looking at lights is a problem. Because, and why does this happen? It is because whatever that is innervating you to see, you to feel, you to eat, swallow, hearing, all the nerves come from your brain. There are 12 cranial nerves. Olfactory, optic, oculomotor, trochlear, trigemina, the one that we are talking about, abducens, facial, vestibulocochlear, hypoglossal, glossopharyngeal, vagus. Vagus is number 10. And then we have accessory, the one that tells you to shrug, and hypoglossal, tongue movement. It's because all these nerves come from your brain, and wherever one nerve is irritated and is producing calcitonin gene related peptide and substance A and K, substance P, they start making your brain and all these nerves to be irritated. Because if it is watching, you have optic nerve, cranial nerve number 1, it is affected. If it is olfactory, is affected. Nausea. You now understand why people vomit when they have headaches. And you now understand why when you have sometime, let me talk about our ladies. When you have something that is called menses, why you vomit. Phonophobia, hearing and speaking. Migraine with aura. Now, because all these cranial nerves are irritated, I usually talk about cranial nerves a lot because they are the ones which are helping you see, talk, feel a sense of smell, hear, have a balance when you are walking. Let me repeat about them again. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, eye, facial, tongue, glossopharyngeal. And then we go to accessory. All these nerves, vagus, accessory, and hypoglossal, they help you. And when the brain, one of it is affected, you start having all these things. You see how migraines come. So when someone is vomiting and has migraines, someone cannot see when he has a migraine. I think right now you are appreciating why. Because the nerve that is supposed to make you see, it comes from your brain. And it's irritating. So there is something that is called migraines with aura. This is migraines that are too much. Migraines that are too much. You check it. Migraines that are too much. You see flashing lights because optic nerve is affected. Zigzag lines because optic nerve is affected. Optic nerve is the one which enables you to see. There is somewhere here which comes and then it goes to the optic chiasma, then it goes to the brain. From the frontal cortex, that's there. You cannot see some places when the optic nerve is undergoing inflammation and the brain is swelling. Sometimes it is migraine, but you can see, but this side you cannot see well. The optic nerve is under inflammation. Tingling sensation and speech disturbance. Glossopharyngeal is affected, the facial nerve is affected. Facial nerve is nerve number 7. It innervates 2/3 of your tongue, and glossopharyngeal innervates 1/3 that is left. Glossopharyngeal is cranial nerve number 9. You see this? Cranial nerve number 9. So when it is affected, speech disturbances is there. Because glossopharyngeal, you talk when your tongue is moving. This is what we call migraine with aura. Migraine with aura. I hope someone is learning something today about migraines. And you see, as we speak, I know, Desert, hey bro, Desert, I want to visit you in Laikipia one day. Laikipia, take me to the slopes. I see those wild animals. Desert, we will plan. I want to visit you in Laikipia. I have friends there that I've not visited, but for a person like Desert who supports me every time, I want to visit you one day. So let's continue. Let's continue, my friend. Now we have normal migraines. Can come one side, can come the other side, or it can come both sides. But we have migraines with aura, flashing lights, around 3 hours from Nairobi. Yes, me no 3 hours. Me, if I want to come to Laikipia, I will fly like a. I will tell you, give me 1.5 hours. I will be there. I will be there. You see, so we are talking, my friends. We are talking about migraines, and everyone is appreciating. If you have come in late, it's good you ask a question. 30 minutes by flight. 30 minutes by flight, but 1.5 hours with my machine. Like Safari Rally. Yes, let's continue. Let's continue, my friend. We have said about migraines, migraine with aura, migraine without aura. So those are two different types of migraines. I will repeat. Migraines without aura, it comes unilateral, one side, pulsating and throbbing, moderate to severe, lasts 4 to 72 hours, then like Desert Channel was bigger Desert Channel, and share too, nausea and vomiting. Then we have migraine with aura, you seeing blind spots, flashy lights, speech disturbances, tingling sensations. So the management of migraines. Let's manage migraines. If you are still watching and you are really learning, say something. Sometimes it's good when someone is learning to say something, my guys. You see, it's good someone to say something. Let's say something. I'm still here in the background, my family and friends. Yes, Jamaican uncle. I know you are doing good things in the background right now. I wish I was near you. I test the one that I've never tested. Yeah. Now let's talk about management. How do you manage migraines? So the next time a person tells you, I'm suffering from migraines, and this person is having a stomach problem, you will know how to answer that person. If someone is suffering from hypertension and this person is saying he has migraine, because nowadays anyone who has chronic headaches says, I have a migraine. I have to take a very strong painkiller, and which is, most of the people take painkillers that are blended with codeine so that they can sleep, and they wake up after 2 hours, they are still having headaches. So when you have a migraine, how do you treat yourself? Take some rest in a dark room, because light will irritate the nerves. We are talking about the nerve, because the nerves are involved, the optic nerve is involved. The optic nerve is involved. So rest in a dark room where there is no light. Switch off the light, rest. Take ample water for dehydration not be there. Paracetamol to stop more prostaglandins to be released, so that you cannot start releasing the substances that we have said. You remember those substances? I'm finding something here. This is tension type. I'm finding something that is here very important. Now, take paracetamol to stop something that is called prostaglandins to be released. If prostaglandins will be released, mediators of inflammation will come, and the trigeminal nerve will start having inflammation. Substance P, neurokinin A, and calcitonin gene-related peptide will be released, and then it will be worse. So we do what? We stop. I always take a lot of water. Yes. And the desert channel, are those what you undergo just normal headaches, or what you undergo are migraines? What you undergo, are they normal headaches or just migraines? Let's talk about that. It's very important. So, we have talked about the paracetamol. We have non-steroidal drugs, NSAIDs, painkillers, NSAIDs, like Brufen, Naproxen, diclofenac. But the problem with these ones, if you have problems with acidity, non-steroidal anti-inflammatory drugs, when you have problems with acidity, these ones will really make you have more acid, and having more acid means continuation of headaches after some time, and immediately a lot of water and immediately stops. You get headaches because of dehydration. You get headaches because of dehydration. Antiemetics. Antiemetics means you take drugs that enabling you not to feel nausea. You know, nausea comes when flow of food. So water does reduce inflammation. Water just balances some things in your body. It does not reduce inflammation. Desert channel. If you are dehydrated and you have headache, it's absorbed fast, and then you balance, the headache stops. So it does not reduce headaches directly, and it depends on the kind of inflammation that you have. So that is how people treat migraines. Antiemetics, I've said, non-steroidal anti-inflammatory drugs, NSAIDs, don't take them if you have acidity issues. Antiemetics. Antiemetics mean drugs that help you not to vomit, like metoclopramide. Metoclopramide, it's the one that you buy in the over-the-counter that is called Placid. It helps the food to flow and the feeling of nausea to stop, nausea-related feeling to stop. If your stomach and your intestines are not flowing food in the right way, what will happen? You will feel nausea. You will feel puking. If you have intestinal blockage or slow bowel movement, gastroparesis, slow bowel movement, you will feel nausea. Chlorpromazine can help, metoclopramide can help, promethazine can help. The best with promethazine, it gives you sleep. You feel like sleeping, and you get good sleep. Severe attacks, sumapritan. Get drugs like sumapritan. You see, these are, you treat the symptom as it comes. And this one is called serotonin inhibitor. agonist. Serotonin agonist. It means it brings serotonin so that up agonist. You release more serotonin so your brain can relax. You remember dopa, serotonin, GABA, those ones. So dopa and serotonin, when they are released, you feel relaxed and good. So sumatriptan is one of the drugs that can help that. It is called serotonin receptor agonist. It works on the receptor. So it helps you to stop the headaches, to relieve the headaches. Now, if you don't have drugs, if you don't have drugs, what can you do? What can you do if you don't have drugs? Desert Channel, let me tell, shout out to Desert Channel. If you are here, you know you want to follow some content, Desert Channel Explorers is there. Hi, do you remember me? The goats I do, please give me your like. You've gone for why have you gone for so long? The goats, the greatest of all times. Why have you gone for so long? Hit the like button and share. Don't go like that greatest of all times. So shout out to Desert Channel, Jamaican uncle as always, giving us true. Sorry, my bad. No problem. The code. Share my topic and hit the like button. Double tap your screen. Let me see your like. Jamaican uncle is here, always watching. Please check him out. Check Jamaican uncle and the good things he does. He has changed from the normal time to 2 p.m. Georgia time. So 2 p.m. that will be 9 Kenyan time. As we continue with our topic, we have Marjay from Jamaica. Shout out from Kenya. Dr. Ben is giving you that shout out. We have Finding Donna 5234. Please check out Finding Donna. Check out all the people. Selena Isaac is here. Selena Isaac, the coffee cakes loving bish. My friend, always and always, the coffee cakes loving bish is in the background listening to me. Queen CNLB, the person who inspires us all the time. Check out the channel. Fiona from Uganda, student who is a lawyer student. Big up all the time, and thanks for you tuning in. And you who is watching and following, shout out to you also. Don't just watch. Let's give you a shout out. Feel good and feel nice wherever you are. This is a channel where we feel good and we guide ourselves about medical tips and medical issues when they come aboard. Now, we have talked about so many things. We have talked about so many inclusivities. We have talked about so many issues that are coming inside the migraine and headaches. So migraine is a form of primary headaches, and we have said primary headaches are headaches that don't come by something. They just come by themselves. It's a disease like itself. So migraine is one, and then we have tension type headache, TTH. It's called TTH, tension type headache. We have cluster headache, and we have other trigeminal autonomic cephalagias. We will talk about them, but today we have dealt with migraine headache. And we have said migraine headaches comes because of inflammation to the trigeminal nerve that have drawn, and they release mediators of inflammation that are called substance P and substance A plus calcitonin gene related peptide. These ones, when they are released, they cause your brain to undergo inflammation and swell. And when your brain swells, what happens? You start feeling throbbing pain. And we have gone to dilation of meningeal arteries. The blood vessels in the meninges, they swell. And we have talked about family risk factors like family history, female sex, stress, sleep deprivation, hormonal changes. That's why it affects women a lot. Hormonal changes every time. Certain foods like chocolate, cheese, and alcohol. So if you are drinking alcohol and getting headaches, you know what means. Bright lights, like journalists when they want to produce good content. Yeah, like me right now, I'm under bright lights. All are watching me. Now, we have said there are two types of migraines. We have talked about migraines without aura and migraines with aura. So migraines without aura, we have said it is one-sided, unilateral. It is pulsating and throbbing. Moderate to severe, it is stepwise, and then it goes up to severe. Lasts for 4 to 72 hours. Nausea and vomiting, and I've explained how nausea and vomiting comes. Sometimes even looking at a light like this is a problem. And then speaking and phonophobia, speaking and you see, listening to some sounds becomes a problem. And then we have gone to migraine with aura. Migraine with aura shows when you have flashing lights all the time, zigzag line, you cannot see one side, you are not, your eyes are watching but one side, you get some blind spots, tingling sensation and speech disturbances. Talking is a problem. And then we have managed it so well. We said you go to sleep in a dark room, you avoid watching from United of Ngong here. That is called United Nations here in Kenya, United of Ngong. So people, nowadays, from today, you understand and you know what migraines are. When you are suffering from a headache, don't come to a doctor's office and you have been following me and you say that you have migraine. Now you know how to categorize what a migraine is. You know, migraine. And I'll show you this picture. If you are coming later, Betty, shout out to you. Leila from Ngong, shout out to you, my sister. I thank you for tuning in. And I've been telling people how to manage. Management of migraine: sleep in a dark room, avoid lights, hydration, take paracetamol to stop prostaglandins. Donna has told me about inflammation. Go through the video. I've explained about inflammation so well. Antiemetics like metoclopramide, I've explained what they are. Severe attacks, you take sumapritan, which helps to increase something that is called serotonin in your brain. I've explained. Regular sleep is very important. Please sleep. Don't stress yourself. Stress management is very important. Avoid triggers like alcohol, stress, fighting every time. Drugs to take are like propranolol, topiramate, and amitriptyline. These ones, they enhance the serotonin in your brain. So that is what we have gone through. It is called migraine. And someone here that is here has been saying that I have migraine. Right now, you know if you've been having migraine or you have not been having migraine. You know, if you've been having migraine, you know, yes, this has been migraine. But sometimes, or some people always say I have migraines, and in real sense, if you look at that person, this is not migraine. You will say that you will see that it is something else out of migraine. And when you tell this person, no, what you're having is not migraine, please go home and do this and that. That person will tell you, no, the doctor, you are misadvising me. But from today now, you know what to do. You know what to talk about when it comes to, we are saying migraine. So whatever that we have gone through is what is called migraine. Please watch this video slowly, stepwise to see. So let me see as we continue, who has any question about anything that we have talked about? Who has any question about anything? If you have any question about anything, please tell me if you have any question about anything that you have. You know, someone asked me, why am I uploading some contents on members only? It's important sometimes some content that is, you know, your members are people that you know, so there's some contents that you see this one is classified, you always put it in members only. So Don't feel bad when I'm putting some classified contents on members only. It's because you understand. It's because of this the situation, So if you want to watch them, you can be a member. Check out the members only channel. You'll see those contents, and you'll be one of my members. But a channel has members, a channel has. But all of you are my friends. Be it you are a member in my channel, be it you are a subscriber. All of you are my friends. So don't feel bad when I'm giving some content on the members only channel. It is because those contents may be classified or some information may be of members only. So don't feel bad about it. So let me get, if you have any question, anyone with any question, open here to listen to your question. And we have been talking about overviews of these things. So let me see if you have any question that you think is an important one, that you think is an important one. Let me see anyone with any questions. How do you manage your headaches? I know someone will tell me, because now you have listened about this topic, you have gone through this topic, and now you have corrected yourself. You will not tell me how you manage your topic. Someone told me that some people manage them with some herbs. With some herbs. With some herbs. How do you manage them with herbs? Tell me how you manage or you have any topic that you want to say. You ask me, just ask. Tomorrow we will be dealing with the other. We are still in primary headaches, and I've said primary headaches are headaches that are of, let me say, they are not brought with something. It's like the headaches themselves are the disease. But you can get headaches that are secondary to something, headaches that are brought by something else. You see, so I've talked about primary headaches, and I've said we have how many primary headaches? We have 4 types of primary headaches. We have migraine, and that's what I started with. Tension type headaches, that one I'll deal with it tomorrow. We have cluster headaches. Cluster headaches are the ones you will learn about them. We have other trigeminal autonomic cephalagias. Primary, it means that they are the disease themselves. They are not brought by something. But headache can be a symptom of something. It can be brought by something else. If headache is being brought by something else, that means that headache is not primary headache. That headache is called secondary headache. It is secondary to something else. So let's talk about the primary headaches. The primary headaches. Anyone who has a question about headaches, please, anyone, if you are here and you're feeling you have any question about headaches, please tell me. Tell me if you are here, if you have any question about headaches. If you have any question about headaches, please tell me, so that I can expound. And today we have dealt with, we have started primary headaches, and we have talked about migraines. We have talked about migraines. So if you are listening and you have any question, I have few minutes left. I have 5 minutes left. Let me get if someone has any headache, if someone has any headache and wants to be treated online, or if someone has any question. Desert Channel has told me that when she is having a headache, he always goes for water, and then it is resolved. I'm still receiving those messages. Doc, Leila has no question at all, at all. Leila, which hotel in Nairobi can I get good pilau, where they know how to cook pilau? The pilau that I ate one day at the coast, the pilau that I ate one day at the coast. Pilau is a rice that is special rice that is cooked in Kenya with some blendings on, some good stuff in it. Pilau. Sorry, my family and friends, I'm busy cooking in the background. Yeah, Leila says, let me cook for you. I'll hook up with my wife, and then one day as you visit, you do cook good pilau. The pilau that I had, though it is moist and it has all the, I don't know how I can explain it. There are some people who know how to cook pilau, from the coast region, where you eat it until you feel that no, this is just rice. This is something else hitting here. Something else that is hitting hard, So my friends and everyone who is watching, I have how many minutes? Oh, my time is going down and down. So you who is here watching and you feel like you have any private question, everyone has my email now address and the other number that I use for. You can WhatsApp or email me anytime. I have 2 minutes left to sign out. 2 minutes left to sign out. So the question that I asked several times about the other thing about members only, have kindly have answered it. Some videos are classified, and I only give members, and when you are a member you will watch them. So when I want to put them public, I have to edit them, but in members only they come raw. You see everything. I have to edit them so that, and editing sometimes with my even coming live, you see, sometimes is a problem. So if coming live is a problem, my friends, editing, I will be doing that, and then I bring them. For now, please sign up for membership, please. I wouldn't like anyone to miss some good things. I wouldn't love anyone to miss some good things. So that is it. And who is having a live today at 9 Kenyan time? I know I'll be watching Jamaican Uncle. And if you have a live, please tell us. If you have a live or a video, please tell us. If you have a new video and you have a channel, and people nowadays have stopped to post their channels, why are you giving up? Post your links here. Post your links so that we can see you while you are doing your good thing. Post it so that you can see. And another thing, there are incidences that you can meet some people that have strange phenomenons. Medicine is a world of several issues. Some things are strange, some things you cannot understand, some things you can understand. If you meet them, please share with me. If you meet them, or you meet something that you cannot explain, or you meet something you cannot explain, you hit me up. Tell me, there is this and this. Let me explore towards it. And if it is a matter that we can bring it online, or if it's a matter that we can discuss it here, we come online and discuss. I've seen several things that people have come through, and they have asked me some questions. And I've tried to explain, though some things were not making sense, and I've posted them. I'm uploading them to the members channel because they are not approved. So that is medicine. Medicine is a broad chapter in human life. So if you come across anything that you don't understand, or someone has gone to a hospital several times and is not getting better. Some people go to hospital for a long time but they don't get better. Please share with me those cases. I like challenges. I really like challenges. So guys, I think no one has a video today, unless Jamaican uncle at 9 Kenyan time. You who's been watching, thanks and be blessed. Share my videos. We grow, my friends. Till we meet again at 10, I'll be here talking to you and sharing all these things at 10. Be blessed, and I love you all. May God be your protector, and you understand? Bye bye.